My name is Professor Bhaskar Somani and I work in University Hospital Southampton. An ideal guide wire should be user-friendly, one that could be used both as a safety and access guide wire, able to pass via narrow or tortuous ureter, be flexible enough to negotiate via impacted stone, yet be stiff enough to be able to help with ureteric stent and access sheath insertion over it without the need to swap to a different wire. It should also allow multiple accesses without losing its character. Guide wires are akin to a safety belt during driving. They can be used as a road map prior to endourological interventions, safety wire during the procedures, and access wire to help with the insertion of scopes and accessories like the ureteral access sheath or ureteral stents. It is therefore vital that they are versatile and can be used without the need to change them during the procedure, ideally where one wire does it all. Sensor guide wire is one such hybrid guide wire which can do it all. They are ideal companions of endourologists, suitable for many occasions. They have a hydrophilic flexible tip on a stiff PTFE shaft which can find its way through strictures and impacted stones due to the design, may minimize the risk of failure or perforation. The radio-opaque tip allows you to see it on fluoroscopy, and its structure gives good tactile feedback. As sensor wire incorporates the various features of individual wires, it therefore decreases the need for multiple wires and maintenance of a large inventory. I have used the sensor wire over the last 2 decades, ever since they were launched, and I started using them as a trainee in Scotland. As an endourologist, we often deal with a mixture of clinical cases, from a straightforward clinical case with an aligned ureter to complex endourology and difficult ureter and urinary system. I have a sensor hybrid guide wire in all of my clinical cases, and it is my go-to wire given its combination of flexibility and torque. It gives endourologists a reliability and confidence in several situations. Sensor hybrid guide wire can be used in clinical cases from access to transplant kidneys, urinary diversion, impacted stone, tortuous ureter, and in clinical scenarios from pregnancy and pediatric patients too. Based on my experience, it can also be used as an access wire in diagnostic ureteroscopy for upper urinary tract tumors, as having a flexible tip, it may be less traumatic and cause minimal bleeding and prevent subsequent loss of vision. Common scenarios for its use of impacted ureteric stones during a ureteroscopy. Inability to get a wire past the stone would usually need the urologist to abandon the procedure and arrange for a percutaneous nephrostomy. Having a sensor wire may make it more likely to pass alongside the impacted stone, serve as a safety wire, and carry on with the rest of the ureteroscopy procedure. Some urologists use sensor wire as their backup wire when the ordinary wire does not work. We have fellows in our department who come for training from different countries. I remember a case where one of our new fellows was using a standard guide wire for large impacted proximal ureteric stone. I was called to help as the stone was almost impassable. I asked for a sensor guide wire, and after a brief manipulation of the flexible tip, the wire was able to bypass the stone and was placed in the kidney. We not only salvaged the situation, but were also able to proceed to the stone treatment, which was then successfully carried out by the fellow. I then explained my rationale to our new fellow of using a hybrid wire like the sensor as my first wire for all my endourology procedures. In a systematic bench evaluation, Sarkisian and colleagues concluded that the sensor wire has a greater friction force and may be the better choice as a secure safety wire compared to a competitor hybrid wire. The hydrophilic tip of the sensor wire is more flexible compared to a competitor wire and is likely a better choice for bypassing and obstructing ureteric calculus. As the hybrid wires incorporate the various features of individual wires, they decrease the need for multiple wires and maintenance of a large inventory. Specifically, in a comparative experimental evaluation by Liguori and colleagues, the Sensor dual flex guide wire had not only the least dangerous tip on the buckling and piercing force tests, but also lower friction values on the friction guide tested on human ureters. These results were significantly better than competitors. Authors believe that to achieve access to the urinary system, the Sensor dual flex guide wire might be preferable because of its non-injurious tip and more lubricious shaft. It has trackability, torqueability, flexibility, ability to navigate past obstructions, and its ability to support another device over it. If an ordinary guide wire fails to get past the stone, one could try plan B, which would be a sensor wire which has a hydrophilic tip that allows to better navigate around stones when the ureter is tight.